By now, you've probably heard about a certain drug that's been in the news a lot lately. It's called hydroxychloroquine. Be warned, I'm going to be saying that a lot throughout this video. It's been one of the most spoken about drugs during the pandemic because there's been hope that it can potentially treat COVID-19. Everyone's been talking about it, especially people like Jair Bolsonaro, the president of Brazil. But perhaps the most famous person talking about it is President Donald Trump.
I can't complain about it. I took it for 2 weeks and here we are.
With all the publicity, there's been a lot of debate about some important questions. Does hydroxychloroquine work in treating patients with COVID-19? And is it safe? Hi, my name is Jamisha and I'm a journalist at BBC Africa. Hydroxychloroquine is a fairly old drug and is used to treat malaria. It's been around since the 1940s, but it can also treat autoimmune diseases like lupus and rheumatoid arthritis. I have a personal connection to this drug because I have lupus and I take hydroxychloroquine every day to treat my joint pain, fatigue, and to prevent my illness from progressing and damaging my organs. But people now want to know if the drug can also treat patients with symptoms of COVID-19. And although we're beginning to find the answers to those questions, there's still a lot of debate surrounding the topic. On one hand, there were small-scale trials done early in the year that indicated that hydroxychloroquine might be useful in treating COVID-19, although not all of those studies were peer-reviewed. There were also anecdotal reports of people who claimed to take the drug and said it helped them. But on the other hand, we had people like Dr. Anthony Fauci, the top US infectious disease expert, who says the drug is ineffective and may cause severe side effects. It can be confusing when researchers and public officials are saying different things, but the best way to figure out if a drug is effective in treating an illness is through something called randomized clinical trials.
We take two groups of population that we are randomly allocate to one group that is receiving the treatment and another that will receive a placebo. And then we follow them and then we just compare the two groups. It's quite easy to do in the sense that we've been doing that for many other diseases during the outbreak, like for Ebola.
So it seems straightforward. Different countries should be getting on with these clinical trials, right? Well, that got complicated as well. The Lancet, one of the world's oldest and best-known medical journals, published an analysis that indicated that hydroxychloroquine increased fatalities and heart problems in COVID-19 patients. This led to the WHO halting their trials due to safety concerns. But then that analysis was later found to have serious shortcomings and was eventually retracted. After that, the WHO resumed their trials. But then after that, in early June, the recovery trial from Oxford University, which included 11,000 patients, concluded that hydroxychloroquine was ineffective in treating COVID-19. But despite those findings, other countries like Nigeria are still going ahead with their own clinical trials.
If you look at what happened in the COVID, the people who were the most at risk of dying are the elder, the old population, more than 60 years old, and also people with comorbidity, diabetes, hypertension, and so on. But the proportion of that kind of the population definitely varies among countries. If you go in Europe or in China, then you will have an important proportion of people with that age. If you go in Africa, more than 50% of the population is under 25. So it's important in the population to be able to see how those particular drugs are behaving.
But it's not just the safety and effectiveness of hydroxychloroquine that's got people talking. The increase of publicity has led to other real-life effects. After President Trump's initial statement about hydroxychloroquine back in March, and then a subsequent increased demand of the drug, there were reports of shortages, price hikes, and health officials in Nigeria had to warn people against using chloroquine, a drug that is closely related to hydroxychloroquine, after there were reports of chloroquine poisoning. This had an impact on people like me who take hydroxychloroquine every day for their autoimmune diseases, and many are still concerned that they won't have access to the drug they desperately need.
Hydroxychloroquine used to be very affordable and used to be widely available, but right now it is so expensive and it is so scarce, it's so difficult to find. My parents and I literally had to go hunting to find this month's supply of hydroxychloroquine, and even after going from pharmacy to pharmacy, when we finally found it, we could only get half the supply we needed because that was all that was available. February this year, at my local pharmacy, a packet of hydroxychloroquine was 1,800 naira. Right now, at the same pharmacy, it is 36,000 naira. The minimum wage in Nigeria is 30,000 naira. The lives, the health, and the well-being of so many people depend on this medication.
There have also been reports of a rise in black market sales, and fake versions of hydroxychloroquine have been seen in countries like DRC, Niger, and Cameroon. Where does all of this leave us? At the moment, there aren't any drugs or vaccines for COVID-19. One of the world's largest studies done at Oxford University concluded that there is no beneficial effect of hydroxychloroquine in patients hospitalized with COVID-19. But not everyone agrees. There are countries that still believe the drug is beneficial and will continue to treat patients with it. Countries like Senegal, for example. And for people like me who have been taking the drug for years, the uncertainty can be anxiety-inducing. For hydroxychloroquine, though, there are more than 200 trials that are still being conducted around the world. The best thing we can do is to follow the research and look out for the results of the clinical trials that are still being conducted.